Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle. Antimicrobial resistance is a global health and development threat which requires urgent multisectoral action to deal with it. The World Health Organization and CSIR Water Research Institute organized a one-day seminar at the Oak Plaza Hotel, Accra, to share and discuss the research findings and implications of the 12 research studies published from the Ghana SOT IT course on antimicrobial resistance studies with all relevant stakeholders. 12 researchers from the various health institutions came joined to communicate their findings to the public. Speaking on behalf of the chairperson, Dr. Mrs. Ruby Asma, the principal technologist at CSIR Water Research Institute, Ghana, Mrs. Lady Asantwa Buama said.
Water Research Institute. The CSI Water Research Institute is one of the 13 research institutes in the Council for Scientific and Industrial Research. So our mandate is to conduct research to generate scientific information in water resources for the development of the country. The fourth objective of the Ghana National AMR Action Plan is to strengthen the knowledge and evidence through AMR surveillance and research. So to support this cause, as an institution, Water Research Institute has been conducting research in water and other related environments. We have conducted studies in drinking water, wastewater, and vegetables. We believe that to fight this threat of antimicrobial resistance, surveillance is very important. It will give us a handle of the different pathogens that are circulating in the environment that are resistant to pathogens to help develop targeted solutions towards fighting antimicrobial resistance. My message to the general public today is that in order to fight antimicrobial resistance, two things are key. First, to prevent the infection from taking place altogether, and this can be done through practicing good hygiene. Secondly, I will encourage the careful and imprudent use of antibiotics to prevent the development of further resistance to these
My name is
antibiotics.
Professor Kwame Ohinibwabe. I am the AMR Coordinating Committee or the AMR Platform, which is a multi-stakeholder, multi-sectoral platform that is leading the process of, that led the process of the development of the first comprehensive policy on antimicrobial resistance in Ghana and then also the National Action Plan. Today has been a dissemination seminar for various research works which has been done by researchers, across different sectors. And in fact, that's what the platform actually stands for. We have researchers that are coming, that are health professionals, coming from the universities, working with a team of other researchers, also multidisciplinary. We have researchers that are coming from the CSIR, Center for Scientific, Center for Scientific and Industrial Research. And then we also have researchers that are coming. These are practitioners, who are also researchers. And the type of research they are doing is operational research, which is gathering data from their everyday work, to highlight the problem of antimicrobial resistance, and then also to give some, recommendations on, some of the steps that can be taken in addressing this menace. We've heard various research works about water quality, in other words, the type of water that is used in what they call it, um, irrigating vegetables, and the type of microbial contamination which we have. We've also heard some from piggeries in the farms. We've actually heard some from effluent from food processing plants, seafoods. We've heard some research works, or we're going to hear some research works from, the use of antimicrobials in hospitals, private laboratory facilities, and all of these are actually highlighting the problem of antimicrobial resistance. And they actually, all of them are talking about multi-drug resistant pathogens, which actually calls for appropriate and pragmatic actions, in actually dealing with this, which is actually in line with the National Action Plan and its implementation. So we're actually getting some very good piece of evidence to really support the national actions, so that we will be able to effectively work with all partners and collaborators. I mean, antimicrobial resist, the problem is everybody's problem. It affects everybody. So that we put all our hands on deck and we try to find a very efficient and pragmatic way of dealing with a very complex problem, you know, um, which, I mean, we've seen some of the issues related to the environment, all right? We see some of the issues related to healthcare, health services delivery, some of the issues related to treatment, right? Of water resources, treatment of effluent, from industries and all of that. So this actually gives us a direction for further research and various actions, in dealing with the issue. So I want to say kudos to WHO that actually led this whole process,
Hello.
right?
It's our time is up. Let's come
And
back
then
to our
so
seat.
WHO and then the CSIR, that is also actually leading the dissemination. And I think the media is now having opportunity. I encourage you to take some of they have developed policy
Please
briefs.
let's
These are
return to
very
our seat.
short summaries of the various. I encourage you to, have copies, and so that we can educate the public about
We'll
this
be going on
menace,
with the next set
which
of
we need to
presentations.
really work proactively in dealing.
Because the prevalence or the incidence of resistance, where people are treated when they have infectious disease, they are not getting the result, the outcome that is needed. And then finding out from the laboratory, and they've seen that there is an increase in resistant development. That is where we are having treatment failures sometimes. So there's the need for us to work on it as a nation and as a world together. And then we're also seeing that antimicrobial resistance is not only with human health, it's also with animal health, even in the plant, in the environment. So that is why we are having one health approach to solve the issue, to reduce the incidence of resistance, and then reduce the spread of the resistant bacteria in the population. And remember, it's human institution, and then sometimes they also base their judgment on their clinical expertise. So from time to time, we need to do monitoring to see if we are adhering to the standard that we have set for ourselves as a country. That if you have infectious disease, you have to use drug A, B, C. So we want to see if they are adhering. If they are not adhering to it, we'll go back and have discussion with the prescribers, the dispensers, the administrators on the standard. With this, we can be sure that we will get better outcome when we are doing treatment. Part of the National Action Plan against antimicrobial resistance, the using the One Health approach. For the animal health, there are a lot of interventions. For instance, educating the farmers on the appropriate use of antimicrobial on the farms, and then also to prevent infection on the farms. They talk about biosecurity measures. So these policy guidelines have been developed. Farmers, section of the farmers have been trained, and they are getting a lot of results in terms of low use of antimicrobial on their farm. And by so doing, they are saving costs and then improve on the quality of their produce. For human, these interventions that we have put in place are many. We continue to create awareness, develop standard treatment guidelines, educate the prescribers and the users on the appropriate use of antibiotics. So these are some of them. And then we also, to prevent the spread of antimicrobial resistance, we talk about infection prevention and control measures. Thank God, COVID has taught us a lesson how to do that. So it is very appropriate that we practice infection prevention guidelines. For instance, hand washing It's very, very important. You have heard from the studies that even in the environment, the lettuce that we buy, they sometimes contain this resistant bacteria. So there's the need that if you handle this, you wash your hands properly, appropriately, before you touch any food that you want to eat. If you want to eat the lettuce, you need to treat them. And they've recommended the use of vinegar, salt, water to treat the lettuce before we use at home. These are the things that we can also do at the community level to reduce the spread of antimicrobial resistance in the community. I would say that if the antibiotic is not prescribed for you, don't go and buy it. Approach the health professionals for advice on the use of your antimicrobials. Secondly, we should all practice infection prevention measures. Hand washing should not be eliminated in our daily life. We should always wash our hand so that we don't transmit resistant bacteria
Yeah,
into
my name is George Kwesi Hedido. I'm a technical officer working with the WHO country office, specifically on antimicrobial resistance and structured operational research initiative. Basically, WHO has been at the forefront supporting countries to implement actions or interventions to tackle antimicrobial resistance in this country. And somewhere last year, we supported a group of 12 researchers build their capacity on operational research to in One Health, operational research in One Health to support provide some evidence-based support for decision making. And today's program is to help these researchers disseminate their findings to key stakeholders who will take some of these actions into their deliberations too. We are helping these researchers to communicate these findings to key stakeholders who will take up some of these findings or consider them when they are crafting policies and interventions to tackle AMR. Basically, WHO aside this have also been supporting countries when it comes to awareness creation on antimicrobial resistance. We know it's a silent pandemic and we need to talk about it so that people get to know what exactly they have to do to prevent themselves from getting resistant infections. And a lot counts when we all put our hands together to fight this menace. From here, we are hoping that all stakeholders will pick the relevant portions that pertains to them, take it back to their institutions and deliberate on it, and then come out with strategic interventions to fight, to implement to fight antimicrobial resistance in their catchment areas as their contribution, part of their contribution towards fighting AMR in Ghana.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.